Infertility can be difficult and emotional for so many women, and today's lifestyle and a lot of things factors can be attributed to infertility. But first, let's define what infertility is. So infertility is the inability to conceive after consistent but unprotected sexual intercourse for like 12 months or more than a year, which can be linked to a lot of factors like PCOS, age, hormonal imbalances, issues with the fallopian tubes and the uterus, a menstrual cycle that is too long, 35 days and more, menstrual cycle that is too short, 21 days, or a woman is not ovulating. These are the causes of infertility. When it comes to infertility, there are several treatments that are available. The treatment of the underlying causes of infertility is the most important thing when it comes to infertility. There might be underlying causes like endometriosis, like PCOS and all of that. So the underlying causes needs to be treated. The root cause of this condition needs to be treated. The first treatment option that we have is ovulation induction. Now, this ovulation induction, they are like gonadotropins, clomiphene. This is when a medication is being used to stimulate the ovary to produce more eggs. Now, this treatment method is helpful for women with irregular menstrual cycle or that are not ovulating regularly. Another option that is available is IUI, intrauterine insemination. This is when millions of healthy sperms are being pushed into the uterus to increase the chances of fertilization. So another treatment option that we have is IVF, in vitro fertilization. This is when eggs is being harvested from a woman's ovary and is being fertilized with sperm outside, that is in the laboratory, and then when it becomes an embryo, it is being transferred into the woman's body. So this is another method. So there are some surgical procedures that can help with infertility. Surgical procedures like laparoscopic surgery. So this type of surgery is just to help to treat some underlying causes. Laparoscopic surgery is to remove fibroids from the uterus and also to repair damaged fallopian tubes. The treatment of infertility depends on the root cause, that you need to know the underlying causes, and that is when you get treated. So many women is undergoing a lot of pressure, a lot of emotional abuse and all of this just because of infertility. Now I'm going to be talking about some tips on how to increase your fertility. But if you're not yet diagnosed, please check yourself. Please go to your gynecologist, get some tests done so that they will know what is going on with you. And it is only when you know the problem that you can get a solution. But if you're just in the house and you're just trying harder, most of the time what people will say is that you need to try harder. That is not the solution. If you've been trying consistently unprotected sex more than a year and there's nothing happening, it is a sign to go see a doctor. It is a sign to go see a gynecologist. If you know that you're preparing to get pregnant, or you're preparing your body to get pregnant, or you are looking into getting pregnant, my advice is for you to take some prenatal vitamins. Take some prenatal vitamins like folic acid. This will prevent some conditions like neural tube defects, and also take vitamin D3. This helps with reproduction. Please always talk to your doctor before you take any medication, because like I said, we have some people that are reactive to some medication. You might be having allergy, or you might be reacting to this medication. It is not a new thing that smoking has some bad toxin that is not healthy for the body. So avoid smoking. Avoid smoking because this can have effect on your ovaries, the production of eggs. Also, treat your infection. Yes, treat your infection, especially chlamydia. There are so many ladies walking around with infection that is not being treated. Most of this infection can result to infertility. So please, when you have infection, get treated. And most of the time when it comes to infertility, you know, like I said, there are some underlying causes like PCOS and all of that. And you all know that PCOS have to do with your weight and some hormonal imbalances. So what you need to do, you need to eat healthy. Stop eating junks. There are so many foods that has effect on our hormonal balance. Foods like burgers, packed foods, you know, any food that is readily available for you to eat. Don't eat junks, and eat healthily. Eat good food, eat vegetables, consume food that are high in fibers. foods like some vegetables, you know, fruits like banana, avocado, berries, and all of that. These are high in fiber, so these are the foods that you should be consuming. I hope this is helpful, and if this is helpful, please share with someone. And it has been found that there are some yoga exercises that you can you know, do that can improve your reproduction. And always know that age has an impact in infertility, and don't be too hard on yourself. Don't be too hard on yourself. So that is it for today's video, and I will see you in my next video. I hope this video is helpful. If it is, please like this video and share with someone who this might be useful for. Thank you.